So we know we've seen that the cases are continuing to increase with COVID. We're hitting record numbers, and businesses are wondering what can they possibly do that's any more than they've already been doing, or what should they be doing that they haven't done before or have done before?
You know, Lisa, you're right. One of the biggest concerns today is the rising numbers and the impact on business continuity, frankly. Um, Most food companies, because they're part of critical infrastructure, built really good programs way back in March and have implemented them. But the challenges today are really just the ongoing weariness of managing COVID in manufacturing, production, retail, food service levels. It's like, how much longer is this going to go on, and what can we do differently? And, you know, our employees get it, but they're worn out. There's a second layer of challenges emerging, though, as the cases increase in communities pretty much across the whole of the United States, in fact, globally. One of the biggest consequences of that is the number of contacts has gone up. So every time somebody gets sick, it's like there's a question, okay, who are you within 6 feet for 15 minutes cumulatively over the last 24 to 48 hours? And that comes up with a list. And that list of people you have to either exclude, which is the safest thing to do, or manage around identifying who's critical and try and bring them back in a safe way while you wait to see what happens. So one of the biggest new challenges, as the numbers have gone up, the cases have gone up, even if they're community acquired, not acquired in a manufacturing environment, for example. But because the contacts have gone up, that's having operational challenges. And as part of critical infrastructure, you need people. And when they're out, because they're a contact, they're not there. And then you're relying on, well, we need temps. And that creates another problem because you don't know the temps. They may themselves be positive unless you get them tested. And at the same time, they don't know your systems. And obviously, fundamentally, if you're making food, you need to do it safely. The temps may or may not know how to do that. You've got to train them. So it's the pressures are just continuing to mount. So we have to look for alternate solutions. Maintaining constant vigilance, training, up to the extent that one can update the same message, revisit it, re-emphasize it, rebrand it, whatever one needs to do to maintain that. At the same time, potentially look for alternate strategies. And one of the areas that we've been thinking about is how can one leverage testing more than we are today? Testing is a complex space, but that's certainly, we need to continue to just recognize that the challenges are increasing. The need to make food hasn't changed. And at the same time, we've got to sort of look at innovative, different approaches to continue to manage the risks.
You mentioned temps, and that obviously, you know, they do get used quite a bit in the food industry. So what can, or in any business as well, but what can they be doing to help ensure the temps are not bringing in cases?
Certainly, the use of temporary labor is, I mean, that's just part of a business model in the food industry. It's just the way one has to be in order to maintain a workforce to be able to produce food or sell food or whatever it is you're doing. I think the challenge around temps go down two roads. One is managing the COVID side of temps. And certainly some temp agencies get that, and they're trying to screen temporary workers, at least through a wellness check. So, you know, have you had a contact? Have you got any symptoms? Some temp agencies and temporary workers are willing to get a test before they come on board. But if the test is going to take 3 days to get a result back, and it really is only telling you what the status was at the time the test was done, you've got a window there, so there's a risk. So there's managing the COVID risk on the temp side. And then the other side of temps is managing your quality and food safety risks. So you have to train them. And one strategy is to say, okay, well, this temporary person that's coming in, we need them to work on the pack line, or we need them to work on an assembly line, or whatever it is that you're going to have them do, and focus training very specifically on that area. Yeah, they have to understand basic GMPs for sure, but but let's focus them on an area and not try to get them trained in the conventional way, perhaps across the board, because they may not be there very long, and you've got to have a way that you can cycle through quick. So on the one hand, you've got the whole COVID thing to manage with Temps, and on the other hand, you've got the whole food safety quality side of thing to manage with Temps. And we have to sort of look at managing that in a balanced way. And frankly, in an ongoing way, because I see, unfortunately, the use of Temps is going to increase, not decrease.
Mm. You did also mention that, they got tested 3 days ahead, and that meant that they were, didn't have the illness at that point in time. So again, that can be a difficult thing to manage. How often do people need to test, or how can you get around that type of thing?
That raises a bigger question around just how does one leverage testing? And I think that, our thinking about that at TAG is, if you're going to embark on a testing program or you're using testing, then understand exactly what you're getting into. Okay. The nature of the test, obviously, is it a swab, nasal, nasopharyngeal, or saliva? It's kind of the three ways that we go for testing, looking for the virus. Is that a PCR-based test, which we know these days is very sensitive, very specific. So it's a very accurate test, but it has to go to a more sophisticated lab to get the result. And that takes time. Even most efficiently, you're looking at half a day to get the result back, typically. The other type of testing is an antigen test, which is, they're becoming increasingly available in the marketplace. They're much less expensive. They're fast, 15 minutes. They are less accurate. They require a greater load of virus to be positive, and we get false positives and false negatives. So, but an antigen test can be done quickly. It tells you a result fast. But in order to get the reliability of that, you need to probably be doing it on a regular basis. So an antigen test, you might say, well, we're going to set that up at the front door. We're already doing the wellness check. We're doing the temperature check. We're now going to throw in a check when you show up. And perhaps it's random. Perhaps it's volunteer. But if you can try to create a cadence where over the course of a week, you're getting 25 to 50% of the workforce going through that and having a test, you get an immediate result. Obviously, if it's positive, you exclude them for further investigation. Maybe a false positive, but you've still identified them. You'll miss some for sure, but you're going to miss them anyway. And it's a more immediate response. So I see these kinds of tests coming more and more into use. We're not quite there yet. And part of it, Lisa, is availability. Yes, they're inexpensive, but there's been a struggle to just get them just through volumes. So we're now at a point where I think food companies, manufacturing environments, at least retail and food service, logistically setting up testing at every restaurant, that's just not practical. But for a manufacturing environment, yeah, I think we have to look at whether testing should be part of your solution. And right now it may not be a part of the solution logically, or it may be. And part of that decision-making is going to be driven by what's going on in your community. If you've got really high levels in the community, then testing might be a better option. If the levels in the community aren't too bad and you're doing okay, then that's okay too. Fundamentally, I think we need to sort of say, well, if it isn't broken, don't fix it. And yet recognizing that it's not broken today, but tomorrow it could be, because you get 5 positives. And well, what are we going to do? And you need to have that game plan lined up. Well, what are we going to do if that happens? And that probably includes a testing conversation. So have that, be ready, be prepared. I think that's probably a key message.
So we've talked about the increasing cases, temporary workers, and some testing recommendations. What other key concerns or recommendations do you have for businesses? Or other key concerns might they have?
Some of the most common questions that are around today are, what's the impact of influenza? What's that going to do to my workforce? How do I differentiate influenza from COVID? So that's a common question. So if we look at influenza, there's good news and bad news on that. influenza, in terms of the symptoms one gets, are almost identical to COVID. So muscle aches, pains, sniffles, sore throat, headache, fever, joint aches, fatigue, sometimes nausea, sometimes vomiting, sometimes diarrhea. All of those things, they 100% overlap with COVID. So if somebody's got those symptoms, you don't know what it is.
Right.
So the message there is, if somebody answers positively to that symptom check, then they need to be excluded for further assessment by a medical professional. Now, the same is true of a cold. Is there a silver lining in influenza? Well, a little bit. Partly is that the controls we put in place to control COVID spread, face coverings, social distancing, hand washing, work 100% for influenza as well, because it spreads exactly the same way. It's a respiratory borne droplet spread virus. That's what it is. And so, and so far, interestingly, at least in the United States, the number of influenza cases this year are quite a bit less than they were this time last year. The other thing about flu is if you go to the doctor with those sorts of symptoms, typically a doctor's office will have a test there, and they can differentiate. So we're going to reach a point where somebody shows up to the doctor's office and says, I've got all these symptoms, and the doctor wants to take a test. They probably can do a COVID and flu at the same time. And it's like, well, yeah, you're positive for one and not the other, and then we can manage accordingly. The other thing, obviously, about flu is you can get a vaccine. We don't know yet whether the vaccine is effective. We have to have a new vaccine every year. It's too early to tell whether this year's cocktail is an effective one, but that is out there. And certainly the public health recommendation is to get vaccinated unless there's contraindications in an individual. And there's a treatment. Tamiflu is out there. And so we're in a, one has to look for silver linings these days.
Right, right.
So, I think from a business perspective, maintaining that, do you have any of these symptoms? I mean, if you do, you exclude until you figure out what it is.
Okay.
Because you don't want somebody in your plant with flu spreading around respiratory illness that has exactly the same symptoms, because you're going to find more of your workforce is out with, they're sick and we don't know what it is. Right. So I think that's the basic message, is stick with those wellness check questions. And if you find somebody who answers in those in an inappropriate way, then exclude them until you can figure out what to do.
Well, thank you, David. I think we've kind of discussed the key issues of COVID-19 and what's happening today. And we will be back to discuss further topics on another video. Thank you.
Sounds good. Thank you.